can we start? Thank you very much.
The operating theatre, a place of hope and fear.
You've been so brave. Rest your head back, sweetheart.
Some of these patients come in, they're really scared.
You're not okay, because I can see it in your face.
We're back in day surgery at the Queen Elizabeth Hospital.
Where's the Queen?
Where the theatres, beds and staff have been rigged with cameras.
We work wonders here.
We use humour in theatre.
So you win some more local anaesthetic.
Capturing familiar faces hard at work.
No karate in here today.
Bless her, look how little she is.
Love you.
Performing complex operations.
You never know what you're going to get. It's exciting and I absolutely love it.
Is he all right? Is he breathing?
And changing lives.
Stand clear, please.
Inside the operating theatre.
I've never had anyone who said they haven't enjoyed it.
My kids always say at home, they're like, oh, I hope you're nicer to your patients than you are to us when we're ill.
All the sympathy in the world for a patient here.
Oh, you poor little thing. And then when you get home, you're just like, is there blood? No, you're all right.
When I had my first baby, I remember the midwife coming round and I think she thought because I was a nurse, I must know everything there is to know.
Are you ready to see Mummy?
Yeah, you are a good boy.
And she said, well, he will have had a poo. I said, well, I don't know how to change a nappy. I've never done it.
I've always been a massive advocate of actually thinking any of the children that I nurse could be one of my children. So how you been keeping well?
Well, sniffing.
A bit sniffy, yeah. It's the weather, isn't it? We've had that horrible change of weather.
After you become a mum, you just want to hug them and comfort them, but you can't.
She's watching you. Did you catch it?
Oh, mate. It bumped on your head. Right, this one's for Teddy.
(8 a.m) and the 5 operating theatres at King's Lynn's day surgery unit are being prepped for patients.
Hiya, you alright?
Yeah.
What's her name, please?
Yeah, Kazetsky.
Lovely. If you just take a seat, they'll be with you as soon as they can.
What things make you happy in your life?
My mum.
Take a seat. Oh, getting old.
What does your mum do that makes you happy?
Go shopping. Do a lot of things for me. You didn't ask me a question.
No, not yet.
She does do a lot of things for people, like my dad. She's a really generous person. Too generous.
Just got to wait now for the nurse to come and get you.
Yep.
Julia, when she was born, went into distress during the birth, which means there's a lack of oxygen to the brain, which is probably what's caused her to be like she is now. It's caused her development problems and the learning difficulties. So, although she can appear to be adult, she's actually really still a child.
Julia is 43 years old.
You sound like you're not awake.
Why?
Yawning.
Oh, I didn't sleep well last night.
She can't read or write. She'll try to cover things, she'll guess at things. Sometimes she gets it right, which is sort of quite promising for her. She's happy when she gets it right. But everybody knows Julia now, so you adapt to her way of thinking. Because you don't know how long it's going to take, and you don't know how busy they are, do you?
No.
She's normally very happy. She doesn't get upset very often. She goes to day centres. She likes doing jigsaw puzzles. She spends lots of time knitting and then unpicking it and knitting it again and unpicking it and knitting it again. But she doesn't give up at things. She's quite persistent.
I like puzzle. A lot of people say they're too easy, but they're not. Some are easier than the other. The biggest one I've done is 4,000.
Good afternoon. Do we have Julia Kozecki?
Yes.
Hello, come with us.
I'm having the camera put up. Find out what's wrong with me.
Bring your friends.
Or your mum even.
All right.
Oh, come on.
Okay, come on then.
When it happened, but I'm not sure how it happened. I just yelled. My mum was in bed. I yelled till the whole street heard. That's all I remember.
We've got your window seat, look.
Oh, you've got a window seat.
Window seat.
That's a bit posh.
I bleed badly, really badly, and I yelled. I said, Mum, I can't stop bleeding. She went, you're joking? I went, no. And I just yelled.
Your seat is just here.
Well, she just shouted at me one night, Mum, I can't stop bleeding. So I went into the bathroom and it was like a bloodbath. I mean, I'd never ever seen so much blood and lots of big clots of blood. I obviously then called an ambulance straight away. I thought she was hemorrhaging. There was just so much blood.
Julia has come to hospital for a hysteroscopy to investigate the cause of her unusually heavy and painful periods.
Now I was worried, very worried, but then I couldn't let her know I was worried because I've got to try and keep her calm while sort of assessing the situation and then getting an ambulance without her panicking.
Hello?
Hello.
Is it Julia?
Yeah.
Yeah.
Okay.
Her surgeon is consultant gynecologist, Mr. Azoma.
So we just need some samples. Okay, so you're happy to proceed
Yep.
with that?
Yeah.
Okay.
Does it get hot in here or is it me?
It's a bit warm.
So why I get a headache a lot then?
Could be.
So hopefully it takes about 10-15 minutes, the actual procedure. And as soon as you're up and awake and feel okay, you should be all right to go home, yeah? So you're still having periods, heavy periods?
No, she's on medroxyprogesterone,
Okay.
and that's sort of stopped that.
You get a little bit, but not much.
That's right, yeah.
All right, everything is all set? Okay.
Okay, thank you.
Okay, all right.
We don't know what it's going to lead to just yet. We're waiting to see. And obviously that's quite concerning. But Julia will never have children. So actually getting rid of the problem that she's got will make her life a lot better.
Come and have a seat in this chair. Okay. Welcome to day surgery. My name's Katie.
Hi,
I'm one of the
yeah.
nurses that works here.
Last Tuesday, I was taking my car into the garage for a repair, tripped on a step and managed to hit a handrail with my nose.
Bless you, I can see you got...
Yeah.
Yeah, bless you. Did you fall?
Yeah, it was
Yeah.
mainly my glasses made all the
Yeah,
cuts.
the cuts. Yeah,
But-
I bet.
Yeah. 1 minute you're walking fine, and the next minute there you are on your back, and so like, what's happened? That was last Tuesday, knocked myself out as I
dear.
fell.
Oh, well, we'll try and sort that out for you today then. I can see that it's not aligned.
I'm having problems breathing through my nose. It is the pain from the nose that is the most bother, but to be able to breathe again properly through my nose will help.
Do you have any allergies to anything, Peter?
Not that I know
Not
of,
that you
no.
know of. Just uniforms?
No, I'm quite happy to see the uniforms.
Yeah. The best bit about my job is seeing patients that sometimes at their most vulnerable, but being able to make them feel as though that they're not on their own. Okay, I won't ask you whether you're pregnant. I think it does say, well, they mark you with a pen, but I think it's going to be more than obvious where the operation needs to be done.
Yeah. Grandchildren, yes, gave me quite a look at first. And then there were lots of questions you can appreciate. They're quite young. How did you do this, Grandad? And yes, it's been quite fun. I think one of them did actually say you won't need a mask for Halloween.
Peter's operation will be performed by ear, nose and throat consultant Mr. Bynon Phillips.
Hello, good morning. Are you Mr. Claxton?
Yes, I am.
Hello,
yes.
good morning, Mr.
Morning.
Claxton. You look like you've really smashed yourself up good and proper.
Oh,
What
I did a
happened
good
to you?
job, yes.
You did?
I tripped and fell, and it was a handrail. I put my hand out, and it was the second one down. It was wet, so my hand went straight through, and of course the next thing is your head, isn't it?
Is your nose blocked?
Yes, quite a bit, as you can probably hear from the voice.
So it looks like you've certainly broken your nasal bones. What we're going to do today is try and reset your nasal bones. If you imagine that the top of your nose here is the roof of a house.
Yes.
At the moment, the roof has sort of done that. So what we're going to try and do is bring the roof back like that. I will do my best to get the shape back to what I think is acceptable, but sometimes the deformity can't entirely be corrected. But I'm sure we can improve on what you've got.
What we've got, yes, at the moment.
You need to perform the operation as soon as possible whilst the bones are still mobile. If you leave it for a prolonged period of time, then the nose is fixed in that position, and that can have an adverse impact on his breathing.
You okay with face masks?
Yes, I'm not too bad. Yeah.
Okay, I'm just going to hold it gently on your face. If you just breathe normally there for me, okay? Big deep breath in there, my lovely.
Something nice.
Hopefully this will put my nose back straight to where it was. Whether it will make me look any better is another thing. I don't think George Clooney will have anything to worry about.
Hello, it's Emma Levitt. Have a seat, Emma, please. Okay, thank you.
Thank you.
I've had this for about 20 months. I'd been out walking one day, and when I got up the next day, my foot really hurt. I'm not sure if that's when it actually occurred, or whether that just the actual walking had actually sort of opened up what was probably there already. I've got no idea, but it took a while for them to diagnose it.
I'll fart if it'll pick it up.
Yeah, I think it will.
Good afternoon. Do I have an Emma Levitt?
You do, yes?
Can you follow me?
Okay.
My name's Sophie. I'll be looking after you today.
Emma has come to hospital with her husband Richard. They have 3 children between them, 2 of those from previous relationships.
Emma's my soulmate, and she's my best friend. I don't tend to have many friends apart from work colleagues, so yeah, she means the world to me.
And he'll be taking you home today. And are you husbands, is that right, Dave?
Yeah.
Pays to never assume in this job?
No.
Because you're having a general anaesthetic, there's some rules to follow afterwards, okay? So for 24 hours, you shouldn't drive a motor vehicle or any other vehicle, and that includes things like tanks, forklifts. I always think of that when it says any other vehicle, not a motor vehicle, I think, well, I might learn to drive a tank or a forklift. Shouldn't operate any machinery or home appliances for 24 hours. That includes a kettle and a cooker, hoover.
You said that on purpose.
It's written, so I've got to say it. And you shouldn't be left alone without a responsible adult. Richard will do. Oh.
Yeah. I find it very difficult to walk any distance. It's very painful. I can't wear normal shoes.
So do you know what you've come in for today?
Yeah, an osteotomy.
Okay. And that's on your left foot, is that right?
Yeah. It's had quite an impact on my life, and I find it quite wearing and tiring.
Our son's just recently moved to Lincoln University, and We went there recently to visit him, but we couldn't actually do much walking while I was there, and I think that really annoyed her.
Emma has Fryberg disease, a rare condition that affects the metatarsal bones in her foot. Today's osteotomy aims to correct the deformity and improve her quality of life.
There's been a fracture in the metatarsal. The blood has been compromised, and so part of that bone's died off. They cut out a section of bone that's died and they put a screw in. But they might also be doing some work on my other toes and pinning those as well, because they've actually splayed.
Do you realise when you text, your mouth moves? When you talk, you'll text.
I've never worn really high heels or anything like that, but I like sort of quite feminine boots and shoes, and I haven't been able to wear anything like that.
Podiatric consultant Mr. Withy will perform Emma's operation.
It's just difficult.
Is it?
Hello.
Hiya.
How are you?
Fine, thank you.
Let me have a look at your foot. How painful is that toe?
That doesn't really give me any pain, it's just that it's sort of just turned sideways, really.
So afterwards you'll have a surgical sandal. You can put weight on your heel.
Yeah.
And you'll need to take it easy for the first couple of weeks. Once the stitches come out, then you can be more mobile after that.
Okay.
Okay. I wanted to be a foot surgeon. I enjoy the fact that I can correct deformity and make a difference to improve people's lives.
When if you put pins in?
6 weeks
6
they stay in
weeks.
for. Right then, and you're second on the list. There'll be a little bit of a wait, but we'll
Yeah.
get you through as soon as you can.
Thank you, yeah.
All right, well, I'll see you in a little while.
Yeah, all right then, thank you.
What do you have to say then?
First 2 weeks, basically do nothing, foot up. He said he doesn't want me going out to the shops or anything. After that, he said start getting a bit more mobile, you know.
Still can't work this bloody puzzle out.
We have a caravan and we go away quite a lot during the season, and so I can't walk very far, so I can't get to explore or go on long walks anywhere.
Right, follow me and we'll go down, okay?
Right. See you later.
Right. We're just going through these doors after you.
Okay.
Hello.
Hello.
Welcome to theatres.
So if you pop your dressing gown and your slippers off for me.
Okay.
I know it sounds like a bit of a sexist thing to do, but she's looking actually look forward to be able to do just simple tasks like housework without being tired, and like I say, it's all difficult for her to walk, even just up and down the stairs.
Okay, so first thing I'm going to do is give you a bit of local anaesthetic, just through the drip, just to make it all a bit more comfy. And we're going to waft a bit of oxygen over your nose. Yeah.
Just take some nice deep breaths.
Once I've got her home tonight, I guess we're just going to sit down and relax, and we'll just watch some TV. I might even treat her to a Chinese.
I'm going to lie you ever so slightly flatter. Well done.
I've got one arm.
Most patients who have a general anaesthetic need to wear stockings to avoid thrombosis.
Should we try a different approach with this one?
Beryl is helping her daughter Julia with hers.
Oh.
Yeah.
Yeah, I don't know where it goes now. Oh. Right, that's round the right way.
How long have you got to have for?
2 days. Takes 2 days to get them on.
Right.
Peter Claxton is in surgery to have his severely broken nose realigned.
So this gentleman's unfortunately had a fall onto his nose, and his nose is deviated to his left side. It's okay at the top, but the mid-third of the nose and the upper third is very much to the left side. So what we're going to do today is try and manipulate his nose back to straight, but what we have to do is check whether the inside is okay or not, so we're going to do that with the camera. So this is the gentleman's right nostril. There's his septum, that's his inferior turbinate. There's not much space up there at all.
You can have a complication called a septal hematoma, which will result in the boxer's nose deformity. So if you've ever seen a boxer's nose with the collapsed nose, that's because the injury has stripped the blood supply from the cartilage, creating a hematoma, and when that happens, the cartilage dies.
There's a septal spur, but no septal hematoma, so that's good. Okay. Okay, so we're going to manipulate this nose now. So what we do is make it a bit worse. Push in that direction.
The only way to straighten the nose is by hand.
Okay, everybody ready for the crunch?
Did it crunch?
It did. It was a satisfying.
Was it? I didn't hear.
It's a graunch. I don't know. It's got a slight onomatopoeia to it. Graunchy.
This term misophonia, but essentially where you don't like a particular sound. And of course, some people, nails down a blackboard brings shivers. My wife, it's metal on metal. And for some people, it's the graunch, as I call it, of nasal bones.
Ta-da!
Oh, that looks fantastic.
Yeah, there we go. So we just have a look down there, and that looks a lot better.
It looks straighter than it was.
Oh, we've got a bit of bleeding. It's... Can we have some patties with adrenaline, please? And some more, please?
Do you want a syringe to wash it out or just a bit of swab?
Or a wet swab?
It's got some good bruising this side.
He has. He's really, really shattered his nose. Okay, so let's have the plaster now, please. We'll keep this on for 7 days if possible. And like the butterfly from the cocoon, he'll emerge as a beautiful, handsome man.
You're going to tell him that at the end.
That's right. We work wonders here. Reminds me of Adam and the ants.
Yes, with the weight
Stand
straight.
and deliver. We're going to have a look now with the camera and see whether there are any problems as a result of the procedure that we've done. There you go. It's a bit more easy to breathe along, isn't it? Ah, look at that. That is much better, isn't it? So that's good. Okay, thank you very much.
Keep the light on standby, please.
Okay, spinning. Drip's okay.
Around 100 people work in day surgery at the Queen Elizabeth Hospital. Many of them come from overseas.
How would you say, hang on, what about the famous actor Edward Woodward?
I can say that.
Well, why you're not even trying?
Good.
Edward Woodward.
Edward Woodward.
Very good.
Robert Redford.
All right. Robert Redford. Robert Redford. Oh, I love it.
There's no critical steps from my point of view. You happy?
I'm happy.
Right, we may proceed.
Emma Levitt is having an operation on her left foot. She has Fryberg disease, where the bone tissue dies due to an interruption in blood supply. Podiatric consultant Mr. Withy will perform an osteotomy on Emma's second and third metatarsals, the long bones in the foot.
We all know about metatarsals due to the fact David Beckham broke his second metatarsal in 2002 before the World Cup. But metatarsals aren't essential just for playing international football, they're also essential for everyday activities such as walking, running, and most forms of exercise.
He begins by exposing the metatarsal bone.
See that cartilage is, particularly on that side, it's starting to fray. Emma has a condition where the blood supply to the metatarsal bone has been affected, which has resulted in some wear and tear, degenerative changes of the joint. The more you use the joint when you're walking, it can often become very painful. But we can see this is all lifting away. Can you see how that's sort of loose on there? But it's surprising how painful they can be for patients. We're going to have to shorten this bone back.
Mr. Withy needs to cut the bone and remove the damaged section.
Right, I'll take the saw, please.
Then he'll realign the bone and fix it back together with screws.
Can I take the 12mm snap-off screw? I'm very demanding, aren't I?
Now that Mr. Withy has freed up the metatarsal joint in the foot, he turns his attention to Emma's two toes, which are bending the wrong way. Using the saw again, he trims the knuckle joints.
Used to work with a consultant, used to do loads of all these little fiddly things, and I always thought I'd never do them, but here I am.
Mr. Withy then uses a wire to straighten the splayed toes and hold them in place.
So that's just, you can see that's closed that right down that level. So when you load it, it just holds it straighter. Oops. And that's closed down that little wedge there. You can see where it's fixed quite nicely now. We've got the wire in it.
The wires will stay in for 6 weeks.
Right. Thank you. So I've performed left, second, third metatarsal osteotomy with PIP fusions to the second and third toes. All counts correct. There's nothing else that we need to discuss. So happy, everyone? Yep. Great. Always a bit fiddly, those take a little while.
Yeah.
All right there. Okay, we're just coming round, okay? It went really well, okay? I'm going through to the recovery room in a minute, all right?
Julia Kozetsky has come to day surgery to investigate the cause of her heavy and painful periods. She has severe learning difficulties and is here with her mother, Beryl.
I'm hoping that they'll find a solution and we get it resolved very, very quickly, because the sooner it's resolved, the sooner she can actually get on with what she wants to do, can't she?
Hello. Hi. I'm Zoe and I'm going to take you now, okay? All right?
Yeah.
God. We got stiff sitting there.
Yeah. Yeah, I know. Well, cramping body, my whole body.
She's got friends at the day centre she goes to and they talk about things. And she says things to me like, will I die, Mum? As soon as you're done, I'll go away and then I'll see you when you wake up.
Yeah, if we get that far, that is. If I die.
If you die?
Yeah.
You won't. I have to always make sure I put on a brave face for her so that she doesn't see any worry.
Hello.
Hello there, come on in.
I say, don't be silly. Of course you won't die. We're going to make you better.
I'm just going to borrow your arm here, give you a bit of a squeeze. So relax your hand now, let it go all nice and loose. Okay, so a bit of a scratch, nice and still for me if you can.
She don't like them.
No, it's not the most fun bit, is it? Well done.
When you've got a child, obviously you worry about them. You have to be strong for them, don't you? You can't let things get them down. You can't let yourself be brought down by the situation. You have to cope with the things that life throws at you, don't you, really? And I hope I try and bring that sort of attitude to Julia so that she can cope with things that happen rather than panicking.
Feeling a little bit more sleepy?
Just about there now, huh?
Sterility of equipment confirmed. Any allergies? Any metal works or implants in situ?
Gynecology consultant Mr. Azoma will perform a hysteroscopy to look inside Julia's uterus.
Does patient require antibiotics? No. So shall we proceed? Okay. Can we have the top lights off? So this is a fibroid. See the blood in the cavity, yeah? It's all distorted in the cavity. See, it's all fibroid. It's distorted the whole cavity, see that? So this is a fibroid as well. See that?
Mr. Azoma has discovered an unusually large number of fibroids in Julia's womb.
Fibroids, it can involve any layer of the womb, and it can grow from anything the size of a grain of rice to the size of a watermelon.
You know, there's a fibroid that is near the cervix, so it's drawn the cervix inwards.
Fibroids are usually non-cancerous, but they can cause heavy bleeding. To check whether they are benign, Mr. Azoma scrapes some tissue from the wall of the uterus, which will be sent off for testing.
So just hold this for me. Because we got a camera in, I'm just hoping I can get in. You see, it's so big. Okay, so let's hope we've got some. Can we shake that a bit and see? Is there anything at the bottom?
It's quite dense, isn't it?
Okay, let me check one more.
Once he gets the results of the biopsy, Mr. Azoma will be able to decide the best course of action for Julia. Either continue on the medication which controls the bleeding, or surgically remove the fibroids.
Okay, that's fine. Well done, yeah.
As long as she wakes up and she feels okay, I'll feel a lot better for her, because I know that whatever is wrong with her is progressing. Well, the solution to it's progressing. So that's got to make you feel better, hasn't it?
Hi there, Peter. Just in recovery, okay?
Peter Claxton is waking up from his nose realignment.
How are you feeling?
Tired.
Tired. Apart from that, are you okay?
Yeah.
Right, ready.
Ready.
We've got a sheet with the details. Hello, Mr. Flaxton.
Hello there.
How are you?
Not too bad.
Are you feeling all right?
Yeah, a bit of a headache, obviously.
Have you? Yes. Well, you've just had somebody bashing your nose about for you again. What's this? That was my favourite aircraft when I was younger. I loved that aircraft.
Yeah, I served with 2 Phantom squadrons for 6 years. I looked after the aircrew.
Did you?
Yeah.
The F4 Rhino, they used
That's
to call
it.
it.
Yes, Rhino. Yes.
Quite appropriate under the circumstances.
Yes.
Good. Okay. So look, your operation went well.
Great. Yes.
Your nose was very much fractured.
I gathered that. I didn't see the X-ray, but
Yes, it was a little bag of bones, really. I think I've improved the shape quite a lot.
Yes.
Your septum is a bit deviated towards the left side. You do have a septal spur to the left side. I suspect that was pre-existing.
Yeah, I was going to say when I was about 17, I playing football and headed somebody.
But I'm hoping what I've done will have improved things for you. Plaster on the outside, ideally I'd like to keep that on for the next week, and then we can have the great unveiling of the new nose.
See the new nose, yes. Okay, thank you very much indeed.
All the best. Look after yourself, okay?
That is sore.
I peaked in parenting pride when my kids, for Christmas the other year, they have like a church service and they did Jingle Bell Rock on the spoons.
Oh, wow.
And I was just like, oh,
Your children were playing the spoons. What was this, 1943?
Yeah, well, I just thought, like, all of our, like, Cockney relatives that are long since departed are just laying there.
Chewing a jelly deal.
Pearly kings and queens.
Yeah.
That was Mum and Dad, all the buttons. I could see you doing that.
Yeah.
There we go.
An hour and a quarter after going into the operating theatre, Emma Levitt is in recovery.
Tracy, right beside you.
Okay. Hello. Okay, so the idea is we'll just keep you here for a couple of readings and then we'll get you back.
Can I have a look at my
treatment.
toes?
Of course you can. Ready?
Yeah.
The big reveal. All right. Look at those. Look at them.
Oh God, yeah. He
Hey?
said he was going to do those, yeah.
Yeah, they're great for picking olives out of a jar.
Good back scratcher.
A good back scratcher.
Yeah.
Ooh.
Not for him though, for him.
I think that'd be grounds for divorce, I think.
Yeah.
If you did that.
Yeah.
Yeah.
That'd be like tiger claws on his back.
Yeah. All right.
Yes,
All the
lovely.
best to you.
Thank you.
Bye-bye.
You took the bloody time. How long have you been in recovery, do you know?
I've got no idea. I just came around a few minutes ago. I've got a very numb foot at the moment.
That's grim.
Cheers for that. Well, I don't need to. I don't think I can see the pins from here. Ooh.
Julia. Julia. Hello, honey. It's all finished, Julia.
You're right there. Who's on the ward with you, Julia?
Mum.
Your mum? Is mum looking after you tonight? Is she cooking you a nice dinner? No? Oh, we're going to get a nice takeaway. Oh, good idea. There you go. You're a bit more with us now, aren't you? Do you know where you are? Should we take it off, see how you get on without it?
Come on then.
How you feeling? I'll go and see Mum. Yeah?
I think she's on her way, she said.
Is she?
Well, that's what she said. Here you go.
Ah, as if by magic. Here she is.
Hello.
There she is.
Oh, you're awake.
All right. Mum's here now.
How do you feel, Will? Same. Same.
All right.
Okay. Oh, that's good.
What's going to happen now, Mum?
We're going to go home.
I mean, next time we come in.
I don't know. But they should be able to tell us next time. They should be able to tell us what's going to happen next time.
Emma recovered well from her osteotomy. She can now walk for 30 minutes, pain-free.
Hopefully, we'll get to the bottom of it, hey?
I hope so.
Absolutely. Right, you take care, okay? Be good. Okay. Bye, darling.
Julia's fibroids were not cancerous, and she's decided to continue on the medication rather than have further surgery.
Everybody's gone home.
And Peter's procedure to realign his broken nose was a complete success. His breathing is back to normal.